How's everybody this morning? Good? Everybody good? Okay, well, welcome. And we have our little PowerPoint. So I want you to be able to see the PowerPoint. I want you to know I worked on it all day yesterday. So we have here with us today Willie and Jenna from therapy and Nicole from therapy. So, and you know, I think you all know me, Kathy Johnson, and we're here to kick off East Castle Place's new Falls Prevention Program. And we will tell you that it is different from just an annual meeting about how to prevent falls. There's going to be a lot more components to it. And, okay, so why do we need it? Why do you think we need a falls prevention program?
Because we fall.
It's sort of like, duh, because gosh darn it, we fall. And unfortunately, it is one of those things that as we age, that dirty word, but every year, more than 30% of adults over 65 and older fall. Over a third of us. And it's the leading cause of death due to injury in this age group. So in Wisconsin, they had the CDC has a nice website, and they have a map, and it looks at by state the how many people fall. And in Wisconsin, we don't fall a lot. 25.7% of people 65 and over in 2018 fell. But we experience more severe injuries and deaths from our falls. We're in the top tier of the number of people who die from falls. So when we do it well. You know, we go for broke. Most falls happen in the home. Only 30% occur outside the home. But when an elderly person falls, hospital stays are almost twice longer than those of elderly patients admitted for other things. So a lot of hospital time. 2/3 of those who fall again within 6 months. So yeah, I know. It's not good, is it? But to me, when I read this, I thought this is why we all need to be concerned. And the most profound effect of falling is the loss of functioning associated with independent living. So it is just really important for us to be concerned. How many of you think we can do something about it? Do you think there's anything we can do? Yeah? Okay, good. And by the way, we end up in emergency rooms a lot. And we end up in hospital. I thought this little comic was so cute. But we end up in the hospital. And Charlotte, you were an inspiration to me. Or we're sent home in the middle of the night after a fall, and we don't have anything to help us with our pain. And that is not fun. Just ask Charlotte. Or we can die. Again, I thought this was a cute little comic. I'm deaf. Well, yes. I'll speak louder.
Oh.
Okay, so how did this happen? How did this all sort of evolve to this? Well, being an old nurse, my thoughts automatically gravitate to seeing a problem, and like you, I was affected by those of our friends and neighbors that we lost in the last year after having fallen. I think that was something that hit us all kind of hard. And so automatically I thought we need to do something to make this less of a problem. So I saw Willie in the hall, and there I am on my knees. Please, please, Tyler, let's do something. Well, he just grabbed it immediately. He's very enthusiastic and providing lots of support to make this happen. I couldn't find a picture of Willie. So here's another Willie Hendrich that I found on the internet. And we'll pretend
that's my long lost uncle.
Well, he's a semi-famous author.
Oh, good. Well.
So here's Willie and Teresa, along with Tyler and Jenna from therapy and her staff, are all working together on this program. And another cute little comic. How do I know you're not just pulling my leg? So what is this program going to do besides just telling you, don't fall, and here's what you can do? Well, it's going to do a couple of things. It's going to, first of all, we're going to depend on you in part to be checking your own risk for falls. I always remember my mother saying to me, and this was only when she was in her 70s, and then again in her 80s and in her 90s, she said, you know, I look in the mirror and I see Lucille, and I feel the same way that I have always felt. So I think we don't necessarily realize how things maybe have changed, that perhaps there are things that we've always done that didn't cause us to fall, but now with changes in our bodies, they might be causing us to become more at risk for falling. And that's hard to see. You know, we don't see ourselves the way other people see us. But still you can recognize what might be problematic. And we have for you, and you'll want to take these before you go, a brochure, of course, a brochure, and it looks just like the one we had up before. And on the back of it is a check your own risk for falling. So on the back of that, and I also provided, if you're like me, and you don't like messing up a nice brochure, I brought just some copies, some plain copies. So please take a brochure and either this self-assessment with it or another copy, and please fill those out today, we've got pens, or very soon. And we want you to give those to Willie.
Or you can hand them in at the front desk and they will put them in my mailbox. Either way works.
Because this will help us get a feel for who is more at risk than other people, and what kind of things do we need to be doing, or does Willie need to be doing. Another really important part is making sure that if you fall, or your spouse falls, you can rat on them, is to let Teresa know that there's been a fall. Even if you feel that you didn't get hurt. This is very important because up till now, East Castle hasn't kept track of the number of people who fall. But in terms of a program, it's important for us to have that information in order to evaluate over time how this program is working. Plus, and I'm thinking about people like my husband, who will say, without swearing, it's none of your goddamn business. Right? I know that for a lot of you, that is something, you're an independent resident, nobody needs to know or have their nose in my business. But I'm a nurse, and I happen to think that sometimes there are times when we do need to, as a community, say, yes, we need to do this so that we have the opportunity to do things that will lessen our risk for falls. So it helps East Castle get a good sense of direction in terms of this whole program. Any questions up till now? Okay, any concerns? Nobody is saying none of your goddamn business? So evaluation, Willie and Jenna will both be talking to you about evaluating when you come in to have an evaluation, a falls risk assessment by them. They'll be looking at a lot of different factors. And yes, they're going to want to look at your apartment for those things that may be causing falls, like looking at your feet. Maybe you're not wearing proper shoe wear, you know, and maybe because your feet are hurting, you're wearing shoes or slippers that aren't proper and cause you to fall. For me and Roy, we now are down to one cat. My little Patsy died 3 weeks ago, and I'm very sad. But our old cat will be 23 in 2 weeks, gets in the way sometimes. And Roy and I have both tripped over her. You know, trying to avoid falling on her, we have tripped. So that's throw rugs. Throw rugs. Pick up the throw rugs. You know, we tell people that thousands of times. But you know what? If you've always had a throw rug in this place, it's hard to get rid of that throw rug. We understand that. But there are alternatives. So we'll need to talk about that. Medications, your balance. So they'll be taking good thorough looks at all of those things. And then the other component will be taking action based on what's causing your falling, what's causing you to fall, or to feel like you might fall. Even if you've not fallen yet, you may have been lucky. So we want to make sure that we avoid that first fall if we can. So taking action to do whatever physically moving needs to be done, taking a really good look at the apartment in terms of what is there. Sometimes it's an electrical cord that's not where it should be, or the throw rugs, dark, you don't have a night light on. And by the way, I saw this on the computer. Isn't this lovely? You can get something that will make your toilet water glow at night.
Glow in the dark toilet.
So that you can aim right for the toilet.
I need one of those, honestly.
Oh,
You can't get sunburn from that, can you?
I don't know. We might all end up with red bottoms, right? And we recognize that we're all individuals. And your reaction to this and how you deal with it is each going to be different. But I like this, we're not all in the same boat, but we are in the same storm. You know, we're all in this age of experiencing changes that do make us more prone to falling. And so we do want to take a hold of it and see what we can do. And I think this is where I probably pretty soon will let Willie talk. Can it prevent all falls? No, but it can prevent a lot. The numbers are in. There are statistics that show that this kind of thing does reduce the risk of falling, reduces the number of falls. So I think we can be pretty hopeful that it is. And I think, Willie, this is yours.
It is.
So, Willie.
All right. How y'all doing? Y'all still awake for me?
Yeah.
I want you all to do one thing for me. I want you all to stand up right now. Just stand up. Stand up. Stand up. All right. Good. You all listen to that. That's good. All right. So what I want you just to do is just move those feet a little bit. We're just going to get the feet moving a little bit. I've been sitting for about 15 minutes, so it's good to get moving a little bit. Good. There Good, all right, now you can sit back down. I just wanted to make sure we got the blood pumping a little bit. I know if you're sitting there for like 15 minutes, I know if I'm sitting in like, when I was in lecture classes and stuff, you fall asleep. So thank you, Kathy, for starting this off in the right direction. I think she really did a great job explaining the why that this is important to be on the top of your mind. Like, why does it matter? Why should we be worried about falling? Well, she hit it on the head, and to me it's really personal because it can cause you to die. It really simply can. And that's not to be a scare tactic. That's to simply say that it can cause earlier death than what you're prepared for. So from my aspect and my perspective here as being the leader of the fitness department, it's really important. Like she said, can falls prevention program prevent all falls? Of course not. Like, it's going to happen. It's like, falls are in some ways unpreventable, but there are steps that we can take to reduce the chance of it even happening, okay? And the big thing, there's practical steps that you can take now, today, to reduce your risk of falling. One, you acknowledging the fact that you can fall. I think oftentimes, we're stubborn, and it's our human nature to be like, oh, that can't happen to me. That's never going to happen to me. But the reality is, it can happen to any of us. Even us that are a little bit younger, we can fall. Like, there's things that can happen.
I've broken my front tooth twice from falls.
Right, exactly. The second thing we can do is assess how your balance is when you're moving in everyday life. So, you can kind of look at it this way. On a scale of 1 to 5, how am I moving in my day-to-day life? 1 being I'm not really moving at all, like I'm just kind of here. Or 5 being like I'm moving freely, just walking around, no problem, no nothing. So if you assess how your balance is while you're moving in everyday life, that can kind of give you the guide in your mind. Is this something I should take seriously? Should I try to work on my balance? Or am I far enough along where I don't have to worry about that? I hate to be the bearer of bad news in this room, but you're all not a 5. You all have some room for improvement. You can get to be a 5. That's our goal through this whole program, is to get us all to be that 5. But I hate to say it, we're not what we were 30 years ago, unfortunately. But we can work on where we are today to improve a little bit each day. And that's where we come in as the fitness department. The one thing we do is we don't have any judgment on whether you've fallen in the past or whether you basically have not used us or been down to do any of the exercise classes or the fitness center. There's no judgment with that. We just want you to come by. We want you to be active and participate in some form of fitness or health-based program to be able to ensure that you're working on these things. We'll also guide you through a falls risk assessment, kind of similar to the pamphlet that you have. The first thing that I want you to do is I want you to fill that out so you can self-assess where you are. Then from there you can turn it in to me, and then I can look it over with you, and we can kind of look at, hey, this is the areas where I think I need the most guidance and the most help to work with, or these are the areas that I feel like I'm pretty good on. So in the falls risk assessment, that's kind of what we'll look at. If in that assessment we deem that there's a little bit more, I won't say issues is not the right word, but there's a little bit areas where you can need more like medical-based guidance, that's where we would pull in our PT department and our OT department just to help you out, to get you that jump start. The one thing with me and Kathy were talking is that is something you would have to call your doctor to say, hey, like, I want to be a part of this. I'm a part of this falls risk program, like trying to reduce falls. Is there a way that I can get set up with a PT or OT because I feel like I need some help with my strength in my legs, or my back has been bothering me, or whatever the case may be. It's, I don't want to say relatively easy to get that, but as long as you explain it in the right way. If we deem that you need to go in that route. Some people don't. Some people, just need some work on their balance, some work on their gait, some work on some strength. We can help you with all of that in our individualized programs and our group fitness classes as well. I already said the personalized exercise. And just make sure that you are set to improve your balance. And that's the last part I'm going to talk about.
Yes.
Perfect.
Wasn't I smart?
Thank you. All right, so how do we know the falls prevention program is effective? The big thing is resident participation. So again, like I was saying earlier, participating in some form of fitness, exercise, balance program is going to be beneficial for every one of you in this room. The great part is I was actually counting it while Kathy was talking. I want to say at least 70–75% of you are already participating in some form of program, which is awesome. So kudos to you all who are. For those of you who aren't, that's okay. The biggest thing is it's taking that step. Again, like I said earlier, there's no judgment from any of us in here. You know, it's just the getting started part is the biggest hurdle I think a lot of people have. It's like, I want to start doing something, I want to start working and improving this, then you're going to start to see progress. And then we can start to measure kind of how that is. The other part of that is if you are someone that chronically falls, and that's okay if you are, you know, seeing a decrease in those falls over time I think is important too. And that's something we'll be measuring as well, which is the number of falls. And then, like it says, the payoff, seeing reduction in falls on a yearly basis with these preventative measures in place, such as participating in programming with the fitness staff, with PT and OT, etc. And reducing the risk of falling by the things in your apartment, which Kathy hit on earlier. So, yeah, I think that's all.
Wonderful. And you know, the therapy is covered by Medicare. So on an outpatient basis, and you know, we are so lucky here. I needed therapy some time ago for a pain in my butt, chronic tendonitis, and Nicole was just, it was so wonderful to just meet her down in the fitness center, get my therapy. I was just yakking at her this morning because I, you know, it's got a flare up and, you know, what do I do? So it's wonderful to be able to take advantage of the things that we have here at East Castle that can help us to do a lot better. So
that's exactly where I was going to start.
yeah. Any questions, any concerns? Yes, Alex.
You talk about fall prevention. You talk at all about how you fall and protecting yourself if you do fall.
That is one thing that Willie and I talked about, and what will happen from here is that we will need to look at, okay, what do we need to do for education? And I think that that's a good point, Alex, and something that we will need to start teaching is if you have a risk factor that no matter what else you do, you still have this tendency to fall. How do you fall? You know, how do you learn to fall in a way that makes you not do damage as much? That makes the falls a little bit less dangerous. So yes, we won't be doing that here today, but that is a topic definitely that we will be needing to address. And perhaps we needed to address that Willie might need to address that with specific individuals. So if an individual has concerns about, you know, tell me how I can learn how to fall so that I don't hurt myself as bad. Yes. Because Willie and I did talk about that. That's
And I think Jenna and Nicole have some more information about that. If you
Great.
guys
Do you
want
want us to?
Yeah,
Thank
absolutely.
you for the introduction, and thank you everyone for showing up. We're excited to start the Falls program with Kathy and Willie. So I want to introduce myself again. I'm Jenna, and this is Nicole. So how many of you, I just have a quick question, have been in physical or occupational therapy? Just raise your hand. At any time in history of it. Okay, then how many of you have received it here at East Castle? Just curious. Okay, a few of you, good. Well, that's where I wanted to start, just to let everyone know that we are contracted through Encore here at East Castle. We're up on the 5th floor in Bradford Terrace. So I know some of you already knew that, but just a reminder that we're right here. So we can come and see you in your apartment. We can take you down to the fitness center. So that convenience factor is huge. There's 7 therapists, 3 PTs, 3 OTs, and a speech therapist. So that is our department. And then I'm just going to share some facts. Some of them might be repeating what Kathy shared, but it's all great information. Falls are a major threat in our population. Every 20 minutes, an older adult dies from a fall. 1 out of 5 falls cause a serious injury, such as head trauma or a fracture. Less than half of the Medicare beneficiaries who fell in the previous year talked to their healthcare provider about it. More than 3 million older adults are treated in emergency departments for non-fatal fall injuries each year. It's a big number. Medicare costs for fall injuries total over $31 billion annually. Hospital costs account for 2/3 of the total. And then a common concern, an older adult falls about every second of every day, but less than half talk to their doctor about their fall. 1 in 4 older adults reported a fall, totaling 29 million older adult falls. 24% of those falls required medical treatment or restricted activity for at least a day. So Nicole and I prepared, we brought a lot of resources that we'll hand out after this. And then if you all have questions, we can be more one-on-one and answer those. One of the handouts is just more information about our outpatient and independent living physical and occupational therapy. So it talks about what physical therapy would cover and occupational. So physical therapy is going to be more balance, exercise to restore motion, strength, joint and soft tissue mobilization, pain management, and Nicole can elaborate more, of course, on the PT aspect of things. And then occupational therapy is going to focus more on upper body strengthening, ADLs, bathing, dressing, and then we also specialize in custom adaptive equipment. So if there's a need for a reacher or something to make you safer to prevent a fall. See that I just, if you want to talk about it.
So I think the main thing kind of to highlight with the falls prevention program is that based on all the numbers that Jenna's read, that Willie talked about, that Kathy talked about, everyone here is either having falls or having losses of balance, but unless some of us who are in positions to help know about it, we're not going to be able to give you the resources or information to help either prevent another fall, prevent a fall. And I think the thing to highlight is that this isn't meant to be, like I said, a scare tactic. It's not meant to be something that we're making you feel poorly about. But there can be serious complications from a fall. I'm sure everyone here knows at least someone, whether it's a relative, a family member that has either had a life-changing or life-ending result from a fall. And I think, like Willie said, just getting started with movement is the #1 place to be, which for all of you choosing to attend to come to this is a really good first step. And I think the biggest thing is, sometimes it can be intimidating, like, oh, I don't know how to work with a therapist, or I don't feel comfortable talking to my doctor, I don't know how I would get to a doctor's appointment. I think the best first step is reaching out to the fitness department here. Even if it's, just a conversation with Willie, like, I whether you're coming to classes or not, I'm a little bit worried about my balance, I'm worried about having a fall, and Willie does a really good job of, like he said, he can kind of screen you and let you know if he feels like, I can work with you one-on-one, I think there's some things we can address, or if he feels like you need more of an assessment by, myself or one of the other therapists here, he can reach out to us and we can kind of negotiate how to set up an appointment with you, working with you. But Willie is a really great place to start just because he's so easy to set up a time with, and he and I work together a lot. A lot of times Willie will be working with someone and he'll say, hey, I really think that they need to be working with you, and so I'll get connected with them. Sometimes I'm working with someone and I think, I think this person's ready to kind of transition to the fitness center. So if the barrier is I just don't know who to go to, I think Willie is a really good place to start. And like Jenna said, it doesn't always mean that we're gonna, prevent all of your falls, but I think there's little things that all of you can be doing to help minimize your risk. And so that's kind of where you have a lot of really good resources here, whether it's with, the fitness center, therapy, even someone like Kathy that's kind of spearheading, developing a falls prevention program. That's kind of what we're here to start with. And I think the other thing that you guys can do is encourage your fellow residents, your friends that live here at East Castle Place to also be taking accountability for kind of assessing how they're doing. A lot of times, sometimes it's the same people that are coming to these, falls preventions program, which is excellent. We love that you guys are, taking such a proactive step, but I'm sure all of you know or can think of someone, oh, I really think they need to move better, or I'm worried about them. Sometimes you can be the first place to start talking to your friends, like, hey, I think you should come to this fitness center class with me, or hey, why don't you come to, this class with me? I think that's a really good place to start as well. So.
Right, and I would say that's a great thing. We do have balance and posture focused classes on Mondays and Saturdays. Probably going to add in another one, just because I'm hoping from this that people get excited about it and are like, all right, well, this is something I need to work on. Like that is a big thing that we stress a lot with our programming, is that balance and that posture type formula type work, because it's so important for everybody, no matter what your age or whatnot. So.
Yep, and I think going off of that too, and different residents that I've worked with, sometimes they express to me, well, I'm too nervous to do the balance classes because I don't want to lose my balance in the balance class. And so there's a couple different ways that we can do that. I've worked with people to improve their balance to a point where they felt comfortable then going to the balance classes with Willie. I've worked with people where I'm working with them one-on-one, so they feel more comfortable because, I'm there with them, I'm hands-on, I'm not going to let them, have a loss of balance. Or maybe you start working with Willie one-on-one first. Maybe you see him and really what you're doing is balance, and then you get to a point where, okay, now I'm comfortable kind of transitioning to the balance class. So that's where, again, we can kind of work with you on, even just getting more comfortable going to some of those, so that that's not a barrier for you in kind of maintaining your balance long term.
Great.
Did you have any questions right now for us? And like I said, we can kind of break off. We have a little station set up over by the piano with a lot of resources to hand out that you could all take with you home. And one is a home visit form that I'm actually not going to send with you, but I'll just show you. There's a lot of good things on here that a therapist can assess. So it's, a reason you could go to your doctor and say, hey, I'm not sure if my apartment is set up safe enough for me right now. Could I get a therapy order so they can come in and make recommendations? So we have a sample of that with us, and then everything else, there's brochures, fall prevention facility program assessment, all this paperwork that you can take with, and our phone number is on there, so you can always feel free to give us a call, ask us questions if you need any guidance in how to start with therapy. So yeah, other than that, we'll be here and you can come and chat with us.
And Teresa also here needs to say a few words.
Oh yeah, sorry Teresa.
Can't leave me out.
Can't leave you out.
Good morning,
Part of
everyone.
our team.
So, by a show of hands, who wears their pendant in their apartment?
Does what?
Who wears their pendant in their apartment? By a show of hands.
Wow.
Wow.
There is count.
Yeah, as long as you wrist, around your neck. So, 3 people, 4 people. So, if you were to have a fall in your kitchen, what are you going to do? And you can't get up. And your pendant's on your nightstand. You're there.
Yes.
East Castle doesn't check on independent residents every day. Hopefully your neighbor will say, oh, I didn't see Mrs. Sunberg today, and call the front desk. Hey, we haven't seen Mrs. Sunberg. Okay, let's go see if something's going on in Mrs. Sunberg's apartment. We go to Mrs. Sunberg's apartment. She's on the kitchen floor. She's been there for 2 days. Had her pendant on. She'd have got help in 5 minutes. So it's very important that you wear your pendant in your apartment. I mean, if you have a spouse, if your spouse leaves to go to the grocery store, put your pendant on. Anything can happen in 5 minutes. Anything can happen in an hour. I mean, you've all heard the story. We've had residents lay on the floor for 48 hours because they fell in the bathroom, they fell in the kitchen, they fell in the living room, pendants in another area of the apartment. It's pointless to have it, and you need it, and you don't have access to it because you don't have it on.
I found that pendant to be unsightly, uncomfortable, and I didn't wear it, just like everybody else. I had it next to my bed. When I found out about the wrist one, this I leave on. It is waterproof. You can wear it in the shower.
It's not.
I never take it.
I mean, it's not a jewelry accessory. It's a form of emergency to save. It could save someone's life. But yeah, I mean,
But it's uncomfortable.
it is. But
So, you have an alternative.
you have an alternative, and they all do the same thing: the wrist, the neck. So if you fall, even if you fall at Syndics, if you fall here, let us know. Just so we can know that you had a fall, just so that we know what's going on, just so we can follow up, make sure that everything is okay. You know, people come up to me, Teresa, you know I had a fall 3 weeks ago. Wow, why you didn't tell me 3 weeks ago?
And I can,
Let us know.
I can say from, the therapy side of things, when I'm seeing people over in the health center that have had a bad enough fall that caused them to be hospitalized, maybe they had a broken bone, maybe they had other trauma, and they come to me, 99.9% of the time, I will hear one of two things. Either I wish I would have used my pendant or had my call light or, life alert, whatever it is that they used, or I wish I would have told someone that I was having falls. So, a lot of times, the majority of what we do, we're seeing people after they fall, after they've broken a bone, hit their head, had some sort of trauma from the fall that requires them to need more of that rehab stay afterwards, and those I would say are the two most common things that we hear. I wish I would have had my light on me or my button, or I wish I would have told someone that I was having falls because now my life is completely changed. So, it's really easy to hear a lecture on it, but from someone who sees people after they fall, those are
for someone who has to go and
they
pick
see.
somebody up that's been on the floor for 48 hours, it's not a good look. I mean, most people use the bathroom within 48 hours. So you can imagine, but I mean, it's they're disoriented, they're dazed, they're confused, they haven't had any food, they haven't had any water, all because they just didn't have that pendant on. You don't have to wear it in the common areas, because if you fall out here, most times somebody's going to see you. But if you're in your apartment and you're alone, and you don't have that pendant on and you fall, you're there. Unless you have a spouse who eventually will, if he's out, come in and find you. But if you're single, it shouldn't even be a question if you should have that pendant on if you live alone.
Where do you get the pendant?
From Teresa.
Well, yeah.
You see, I'll get you one. Our system showed that you had one. But if you can't find it, let me know. We can definitely get you another one. It's no big deal. I'd rather you have another one than not have one at all.
Yeah,
So I'll get you one, Miss Johnson.
I had it and I don't have it anymore.
Okay. Miss Miss Sunburn.
You test these once a year?
I do. We just have it because of the pandemic. But if you want to test it, absolutely let me know. I can come to you, you can come to me. Yes, Mr. Hill.
What capability does that have if you're off-site?
0. If you're at Syndics, it's not going to tell us you're at Syndics. If you're here, it'll give us a general area of where you are. But it's not going to tell us if you're down the street somewhere.
Okay, so as soon as you leave the premises,
Yeah, it's pretty useless.
you're on your own.
Yeah, so don't fall. Yeah. Yeah.
Work on your balance.
Work on your balance.
Didn't Mark say that if you were on the sidewalk adjacent to the property, that they would identify you if you crossed the street?
Okay, that I'm not aware of. I wonder what it's gonna say though.
What?
I said, I just wonder what it's gonna say if you're
On the
adjacent.
sidewalk somewhere, yeah.
I don't know.
I don't,
I'll have to
I
I think I read that too. I think that came up and,
You should check.
Oh, yeah, I'll have to confirm it. Yes, Mrs. Frady.
My question is related to hers because some while ago, I remember they came around to all of our apartments and checked where the reception was and so forth, and we were supposed to have been getting a different system that would in fact encompass areas outside of your apartment, because
I think they put that in water tower. I don't know if they're, when they're gonna start that for independent living. I kind of remember when they had some guys here putting in new systems outside of the apartments. But I don't think it's effective for independent living as
so
of yet.
we need to talk to Tyler.
Yeah, that could be a
about
Tyler issue, yeah, absolutely.
And I think the main thing is that, you know, a lot of times when falls happen, even if it is on a sidewalk or you're at a store, there's gonna be someone there that sees you fall to get you help right away. But when you live alone in your apartment, there's no one there to see it. So, you know, a lot of the falls that we see that are the bad falls oftentimes are the ones where it happened in your home. We always say the worst falls happen in your home because people get comfortable in your home. Maybe you don't use that assistive device you should be using. You know, you're thinking about all the other things you have to do. You kind of think you're safe in your home. But, you know, in the community, if you fall at the grocery store, even if you fall walking on the sidewalk, people driving by, people walking by. I mean, the East Side community is a really busy place, even with COVID. So there's going to be someone that sees you and can get you help right away. It's really more those falls that happen in your apartment where you're alone and there's no one to kind of witness it or get you help right away. So the pendant definitely is most important in your actual apartment, you know, even within East Castle Place, like Teresa said, you know, we don't want you having falls, but if you're gonna fall, those falls in the community, oftentimes people get help right away just because people see it, so.
Yes, ma'am.
So just to confirm then, these pendants really only work, well, I shouldn't say only work, but if my pendant were to go off because I had a fall in the fitness center and no one happened to be around at the time,
It might give us the general area of the fitness center. It might say, laundry chute by fitness center, laundry chute by lower level health water tower. It might give us some general area. And if it doesn't, if you push that pendant, first place we're going is your apartment. If you're not in your apartment, then we're going to come looking for you. Because we have to find it in order to acknowledge it to find out if you're okay. So if you push it, it should give us a general area. If it doesn't, we're going to your apartment first. You're not there, then we have to look throughout the building to find out where you are. Because we need to, one, find out if you're okay. Two, we need to acknowledge that somebody's been there. And if you push it, and you find out, okay, you push it, the nurse is supposed to respond. And here we are 20 minutes in, nobody's there. You push it an hour, I need to know that. Because when you push that pendant, someone should be there 5 minutes, 10 minutes or less. Because obviously you push it for an emergency. And that's the only reason you should be pushing it. And the nursing staff knows that if that pendant goes off, they need to respond. So if you're pushing it and nobody's coming, then I need to know that. Because you shouldn't be waiting an hour for a nurse. You shouldn't be waiting 30 minutes for a nurse. You shouldn't be waiting 45 minutes for a nurse. You shouldn't be waiting 15, 20 minutes. Somebody should be there. So if that's not happening, let me know.
Where are they coming from? Because most of the time there's nobody around after.
During the day shift nurse Lena responds. PM shift is nurse Deb. I should say water tower nurse. Day shift is water tower nurse. PM water tower nurse. Night is the nurse at the health center. That should be responding. With security at night.
Because at nighttime there's nobody at the security desk at all.
Right. Security doesn't sit at the desk. Security does rounds. Security has a pager. And security has a telephone. So if you call the front desk, security should still be answering the phone even if they're not sitting there. Because they should be transferring their phone to their cell phone when they leave the desk. So if that's not happening either, I need to know that. Because every time you call the desk, somebody should be answering the phone. Regardless if security is sitting there or not. They should have that cell phone with them. Anything else? This mask.
Oh, thank you, Teresa. I need somebody to take a picture.
I can't talk with this mask on.
I took mine off,
Oh.
which I'm going to do again to close up. How do you like that?
Got a question, Ms. Hill?
Well, I had a comment going all the way back to Kathy's
Okay.
original presentation about reasons for falls.
Yes,
And I think this is more prevalent with women who are doing multiple things at the same time. You get up, you pick up this, you pick up that, you're gonna drop this off and so forth.
yes,
And you are not focusing on your feet.
right. And that's why it's gonna be important for Willie or whoever assesses to know how you operate in your apartment. And, you know, so that you're talking about, well, you know, here's this, I picked this up, and blah, blah, blah. Because those are the kinds of things that do make you more prone to a fall. And that then we need to start thinking about, okay, how do I change that habit? How do I change that behavior? So that it reduces the risk of falling. I mean, it's how we've always lived, isn't it? I mean, it's what we've always done. And sometimes what we've always done is just no longer a real good thing. it's putting us at risk in some way. So sometimes it's just, and that's hard for us to do, to evaluate what are we doing that makes me more prone to falling. That's a very difficult thing to assess. Whereas an external party can go over all of that with you and observe you and see, oh yeah, this is what you're doing. Did you know that's what you're doing? I remember in therapy, Nicole pointed out, you know, some way that I was stepping that was making it more difficult for the tendons in my butt. And so, yes, you have to be aware of how you're doing things. So that's a real benefit, I think, of having these people around us. It's opportunities to make our lives better, make our lives safer. Any other concerns? Do you think, are you more convinced now that we need a falls prevention program? Mm-hmm. Does this sound like something that will be good for East Castle?
Yes, oh yeah.
Okay, good. So we're on the right track. Excellent, wonderful. And it just makes me so happy that Tyler really just took off with it, and that Willie was just so enthusiastic, and Teresa really wanting to make this work for the benefit of the residents. So thank you for coming, and here's brochures, and there's all kinds of them there. If you want to fill out your falls risk while you're here, Cooper told me there's some pens somewhere. Okay, and if you did not sign in, if you would please do that. If you would please sign the thing at the back, the sign-in sheet. That would be helpful, because I want to be able to reach out to people who didn't make it here. Scott, thank you, Scott, for videoing it, and so we can start making that available too. Or if you want to watch my lovely PowerPoint again. So thank you very much, and I have additional copies of, I think I'll maybe just put these here also, additional copies of the self-assessment. So thank you very much for coming, and if there's anything, I'm the resident representative on the team, so if you have ideas, if you have concerns, if whatever, just give me a holler and be happy to chat about it. Great. Thank you.
Thank you. Okay.
Thank you.